One of the questions that I get in admissions a lot is, what type of patient do we work with? Who is Riggs for? And it's tough to answer that question because really we look at each individual on a case-by-case basis to see if this is right for that person. We don't have any tracks by specific diagnosis. We work with a broad range of ages, patients 18 to, I think our oldest patient was 82 recently. We're really assessing whether or not someone can utilize this type of treatment, the psychodynamic psychoanalytic approach, and if they can be safe in the open setting and utilize the combination of individual treatment and the groups and community structure of the program. I will say that, what probably won't work here is someone who is under a guardianship. We can't work with someone who legally can't make decisions for themselves here in treatment. We do rule out for, significant aggression towards self or others. Again, someone needs to be safe in the open setting. We don't treat active substance use, though we do provide a lot of support for people who have been utilizing substances to kind of manage their symptoms, but it's maybe not a full-on addictive process at the moment, and they can remain abstinent in the open setting but need that support. We're not treating active eating disorders due to the nature of the open setting, and the type of treatment we offer just doesn't lend to someone who really needs more medical stability or more eyes on patients in a regular way. That said, again, we do have a registered dietitian on staff who can work with patients who have a history of eating disorder or disordered eating symptoms and can help, maintain their stability in the setting. But ultimately, we're working with patients who are motivated of their own volition for treatment, that there's something that they want to get to that maybe other treatments haven't been able to get to. Behavioral treatments haven't worked for them, various medication trials haven't worked for them, and they're ready to do a deeper piece of work, a deeper dive to get to the core of what their struggles are, and utilize the relational approach that we use here at Riggs to understand something about themselves, both in relation to their individual providers and also to their peers in the community, and utilize that learning opportunity kind of in a slower, kind of longer term way.